America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producers today, Mr. Garner Cowdery and Dave Thiessen, here in studio with me in the Cumulus studio in Overland Park, Kansas. If you like the broadcast, if you follow the broadcast, you can do that on YouTube and our 15 podcast platforms. So you can click follow, you can subscribe. By the way, there is no charge for that, or just like us. So up on YouTube, up on the podcast platforms, please feel free to do that. Today's a little unusual. When I say the doctors are in the house, I've got 3 doctors in the house this morning. So I want to welcome Dr. Carson, Dr. Daneshgari, and Dr. Andersen. Welcome to the show. All of you have done the show before. I was glad to have you all in here today.
Thank you.
So in 19 years of doing this show, Dave, I don't think we've ever had 3 doctors in studio before.
It's a record.
Yeah, this is definitely a record. So like I said, when I say the doctors are in the house, I mean the doctors are in the house. So what are we going to talk about today? Well, we're going to talk about Brand New Day, the clinic model, how it works. We're going to talk about some of the non-invasive technology that they are using, like the Neuro 20 suit, like the red light treatment, and like the WAVI brain scan. We're going to combine all of that into a show that I think you're going to find fascinating. Let me just start with a little something here. So, I always say when I do these shows, whether it's a Blue Cross product or it's Focus Hearing or it's something like Brand New Day, I don't put people on the air here that I don't use the product or believe in the product. Well, I bought a Neuro 20 suit, okay? And my wife and I are using it. And I have to tell you, it's pretty remarkable. I've never done anything quite like this. I know a lot of you know that I've talked about my habits in the past. I am a gym rat, so, I'm in the gym at least 3 days a week. But this suit is absolutely remarkable. Now, I'm not using it for anything other than training and conditioning, but my wife, as many of you know, I've talked about it on air, suffers from heart failure, and we are convinced that this suit is going to make a big difference for her. Hence, she is using it. So, again, like I said, when I put something on the air here, there's a reason for it. I believe in the product. I endorse the product, and usually I use the product, and I most definitely am using it now. So let's just start out, Dr. Andersen, with Brand New Day. This is a brand new concept.
It is.
So let's just start right there and kind of fill the audience in on how Brand New Day works and these technologies that I was talking about, Doctor.
Well, I think when we hear about things beginning, it's a brand new day. We will oftentimes say that moniker, so to speak. And that's exactly what we are doing here. It's a brand new day in integrative healthcare. And that means we are taking the best of every technology that we can get our hands on to help people heal. And that includes nutrition, supplementation, bioidentical hormone replacement therapy. It may mean moving their medications around a bit or helping with some of that. But key on top of that are the therapies of Neuro 20, the suit that you just mentioned. And it is a FDA approved medical device. So it does require a prescription from a physician or nurse practitioner. And the basis of that really is that it is stimulating brain derived neurotrophic factor, which is essentially a process of regenerating the nervous system and recoordinating the nervous system. And it doesn't matter whether you have heart failure like your wife, or whether you have Parkinson's, or whether you have had a TBI, there is a disruption in the electromagnetic system of your body. There's a great book out called The Heart Speaks. That is about how the heart actually drives the body. It is an electromagnetic device. And so when we can improve the signature, that electromagnetic signature in the body, the heart can improve. In addition to that, then we also have some red and blue light therapy with infrared that helps to stimulate blood flow in the area and helps to stimulate further healing if we have chronic pain, if we have non-healing ulcers or something that has actually damaged the tissue physically. And then our evaluation, the WAVI, which is a special EEG that looks at what's the functioning of the brain. And it's a fabulous tool for either telling us we have had a concussion or a TBI, which really is a big problem in sports today. It's a big problem in the military. It's a big problem in our first responders from explosions and so on. And the problem is that standard medical evaluations for TBI or for the return to play are insufficient to really give us the safety that we need. And the statistics show about 35% of athletes that are supposed to return to play, if we do a WAVI on them, their body says they're not ready to go. Their brain says it's not ready to go. So a brand new day means we're putting all of these things together for whatever it is that person is suffering from, helping to restore homeostasis.
So the key word when you started this segment was the word integrated.
Yes.
Our healthcare system, Dr. Carson, Dr. Firouz, we'll certainly talk about this later in the show, is not integrated.
That's correct.
You go see this physician, whatever they're doing is isolated to that practice. If they send you over to a specialist, that's isolated to that practice. A is not talking to B, B is not talking to C. And when you try to pull the results together from seeing multiple physicians, it's very, very complicated and very difficult. The big difference here, because Lauren has gone to the clinic, that's how we started this before we bought the suit, was she actually went there and did the work in the clinic, was the fact that all of this comes together. But the other piece to that is when you talked about WAVI, and before we go to break here, you have a way to measure the results.
Correct.
This is not conjecture. Nope. This is not we think it's working. This is we have actual measurement device. So quickly before we go to break, we got about 2 minutes here. Talk about how you're able to measure the results of using these other tools, doctor.
Well, the WAVI is, as I said, it's an EEG. It's measuring a P300, which is a primary brain wave. And what it's doing is it's looking at, one, how is that wave integrated throughout the brain? And we know that there's different components of the brain that do different things physically with our body. And as well as then there's certain parts of the brain that have to do with how we speak, how we think, how we remember, and all of those kinds of things. The WAVI gives us a picture of what area of the brain is functioning like it's supposed to, what area of the brain is not functioning like it's supposed to, and then how is that integrated? That then we look at that and we say, oh, well, that correlates to that person's physical ailment. This is what we need to do then in order to evaluate that. Well, then when we put them in the suit, we have that baseline to tell us how is the brain functioning. We put them in the suit for a while and then we come back and redo their WAVI. The WAVI changes. And the real interesting thing about it is the suit is on your body. We didn't put the suit on your head. The suit's on your body. And so the unique aspect of this is you're getting a feedback through the central nervous system, the spine, back into the brain to reintegrate the brain.
It's quite remarkable. And when I come back from the break, we're going to go to Dr. Firouz, and he's going to talk about what he just did in Albania, of all places. So this is going to get quite interesting. The website, if you want information, you want to learn more as you listen to Dr. Andersen describe that, brandnewdaykc.com. Brandnewdaykc.com is the website. Stay tuned. We'll be right back after the break. The doctors are in the house. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. I get a lot of emails up there. I answer each and every one of them. So if you want to contact me about something you heard on the show or a topic you'd like to have discussed, please feel free to do so. Or if you just need help with something, reach out to us. We'd be happy to do that. My producers today, Mr. Dave Thiessen, who's behind the cameras and puts up all these shows us on our YouTube channel and podcast channel, and Garner Cowdery here in the Cumulus Studios, handling all the work on our production board as we get this show out across the air. Now, it's interesting. We've done 3 of these shows so far. We've had people from Washington, D.C. come in here to get treatment at Brand New Day. We've had people from Mississippi in here. We've had people from California in here. So we've got people from across the country who are seeing how this works and the difference that it makes. We had a gentleman in here, I believe he was from Washington, D.C., who came into the studio. I noticed he had a little bit of a limp, and he sat down and we told his story with Dr. Andersen. It was quite fascinating. He had drop foot, all right? And as a result of the treatment at Brand New Day, he is walking like he doesn't have drop foot. He's got a bit of a limp, if you will, but from where he was before, where he couldn't do anything but use a walker, it has changed. So anywhere in the country, if you're looking for help, you want to have a conversation with Dr. Andersen or Steve Sanborn, please feel free to give them a call at 833-724-6522, 833-724-6522, or their website, brandnewdaykc.com. That's brandnewdaykc.com. All right, Dr. Firouz, I can't believe you actually went to Albania with this and brought the suit. Talk about your charitable work that you do there and how you actually went there, took the Neuro 20 and what you did with it. Dr. Firouz?
Good to see you, Cary.
Great to have you back.
So as we were discussing before the show, I do have a charity called MD Aid, Medical Doctor Aid, that provides charity services to people who are less privileged. And I have focused on Albania over the past few years. So I want to kind of set up a tone of a cautious here, though. I'm at the heart, I'm a scientist. I have, been privileged to be awarded from NIH for multiple years. So for me, it was really a scientific journey. In the scientific journey, you start with a theory, with a hypothesis. And the hypothesis in this case is really the new model of neuromodulation that this Neuro 20 is creating. We've known about the effect of neuromodulation for about 30, 40 years now. The simplest one or the easiest one was the heart pacemakers. Many Americans, it's really a neuromodulation of the heart electrical system. Our body communicates through 3 mechanics. Chemical, we use that to create pharmacies, is the mechanicals, and then electrical. If you go to the physiology cell, there's a concept called action potential. You literally can measure the balances between electrical impulses inside and outside the cells. So the neuromodulation over the past 30 years has expanded to other parts. I was privileged to use the neuromodulation for some bladder dysfunction in my field in urology, back in early 20s at Cleveland Clinic. And so in this case, I had a case of a Parkinson-like syndrome person who was a young fellow who was exposed to explosion, and he had this tremor on the left side. And he was on maximum medical therapy. And the next step for him was consider what is called a deep brain stimulator, which is a neuromodulation electrode is put in the hypothalamus and it has shown some good results across the country. So to me, the theory was, can I basically help this fellow with a lesser invasive device? And so the point of scientific cautious here is, that is how the science works. That's how we go from unknown to known. We start with case studies. We see some early evidence that this is working. There's a famous case study I say is Dr. Cushing, who is buried in Cleveland. He was a neurosurgeon. He discovered one of the most important clinical entities we call Cushing syndrome by seeing about 5-6 patients who came to him. They had moon face, hunched back, and he realized they have tumor in in their brain. So these are the cases we are discussing here. There are case studies. So I want to give a warning on that. The next level is the case control studies, and after that is the randomized trials, where we go and basically prove the concept compared to standard therapy. And that is the second, that's the first one. The second point I want to say that Neuro20 is FDA cleared. That is the difference between FDA cleared and approved. FDA cleared means the FDA, through a mechanics of 510, basically they have said you're exempt from the approval and so forth. So with that concept, the concept of neuromodulation that Neuro20 is exploring, that you have multiple basically neurostimulation part to reawaken the brain or the neurocirculatory pathways that have been either disturbed, dysfunctional, or has gone away in the case of the stroke and so forth. So I took this in, and within about 2 weeks of this doing neuro 20 stimulation, we have seen significant improvement in the tremor of the hand, in the walking, and the posture of this gentleman. And there's a video which is very remarkable. So I'm here actually to discuss the next level with Dr. Carson to see how we can start reducing the medication that this gentleman is taking. So if this continues to basically persist, it's really a remarkable result that we have gained a non-invasive method of treating a condition that used to have a lot of expensive and invasive treatment options.
You know, it's interesting when you described the option for his first treatment, that was going to be a surgically implanted device.
Correct.
Okay. And instead of having to do that,
correct,
the Neuro20 suit was able to show results in a matter of 2 weeks without any type of invasive device. I mean, when I look at what this suit can do, the red light, blue light therapy, the other things that are combined, I think the key factor that attracts people to this, one of the key factors, is it is non-invasive.
That's right.
Yeah. You're not taking a medication. You're not having a surgery. You're able to do these things. And as Dr. Andersen talked about, measurable results, doctor.
Right. But again, I want to put us a word of caution here is, again, this patient had what we call the Parkinson-like syndrome. Mm-hmm. So he was exposed to a massive explosion, and this tremor started after that. The question of how much of this applies to all the Parkinson conditions, because
that's
there
are
different topics and so forth. So these are the stages of the basically scientific advancement. But so far, the case studies proves the theory that this could be a very active alternative for patients with Parkinson.
And I think that's what we're seeing. We'll talk about some of those. We've had some Parkinson's patients use this suit and have some amazing results. And we'll talk about that in some of the other segments. When we come back from the break, we're going to talk with Dr. Carson. And now we're going to talk about a condition called transverse myelitis. I do not know what that is, but we're going to find out, okay? And how Neuro20 is being used to treat that person with transverse myelitis. I hope I'm pronouncing that correctly. We'll be right back after the break. If you want information on New Day, the phone number 833-724-6522, 833-724-6522, or brandnewdaykc.com is the website. They're happy to help you any place in the country. Give them a call. Stay tuned. We'll be right back after the break here on America's Healthcare Advocate. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast on the HIA Radio Network. You can find out more about us or contact us using the website, americashealthcareadvocate.com. You listen to this show, listen to the level of expertise in this room. We've got 3 doctors here that have talked about this in terms that are really quite remarkable. If you want to share this with somebody, maybe you know somebody that's having issues. Maybe they've got Parkinson's. Maybe they've got MS. We're going to talk about that. Maybe they've got some other conditions. You might share the podcast with them or share the YouTube broadcast with them. We have had people come in here from all over the country for treatment. They are finding some remarkable results, and the program at Brand New Day works exceptionally well because, as Dr. Andersen described, it is integrated healthcare. It's not a one-off. This is an integrated program that works. I know it works because my wife is doing it. All right, let's switch to Dr. Carson. How are you, Dr. Carson?
Hey,
thank you for coming up here from Mississippi.
Yeah,
Dr.
thank you.
Firouz,
Glad
you
to be
didn't
here
fly in
again.
here from Albania, did you?
No.
You flew in from Cleveland. That's right. All right. But you flew in. Welcome back. It's been a while.
Yes, it has. Thank you.
Okay, so let's talk. First of all, define what transverse myelitis is, so for the audience understands that, and then let's talk about this case.
No, thank you. Well, it's a rare condition. This was a young lady, a client of mine, that reached out to me for help. Her family did. She was diagnosed with transverse myelitis at the age of 11. She's now 23. And what it is an inflammation. Anytime you see the itis at the end of a word, think inflammation.
Okay.
And so there's a what's called a myelin sheath that surrounds our spinal cord, protective sheath around the spinal cord. And basically what transverse myelitis is an inflammation of that myelin sheath. Inflammatory condition that affects her ability to be able to function normally, particularly to walk normally, to be able to move around like, we do, like you and I do. We stand up, we walk around, we move around freely like we want to. But she's pretty much bound to a wheelchair most of the time. She can use a walker for limited mobility. But yeah, that's it. It's very sad too that this happened to a young child like this and put her in that kind of state.
You identify a condition. You got her here to Brand New Day. Talk about what happened after that.
Yeah. Well, in working with her, and helping correct some nutritional deficiencies that she was struggling with her particular condition, Steve, in the process of all that and me working with her, Steve was feeding me these stories, telling me all these amazing things that were happening at Brand New Day Clinic here in KC that he was seeing with people using the Neuro 20 suit, people using the Firefly light therapy. And I was thinking, this young lady could benefit from this tremendously, I believe. So I talked to her and her family about it, and then made the decision to come here and spend a week at the clinic, getting therapy every day. And I, of course, you don't know. You hope and you pray that a person's going to get results. I was overjoyed with the results that she got.
What were the results?
Yeah, well, she began to move parts of her body and more freely that she couldn't move before. I think one of the first things that Steve reported to me was her ability to be able to move her foot back and forth. She could not do that. And that was, I think within the third day of her therapy, she was moving her foot. She was able to begin to raise her arms up that she couldn't do before. And those kind of things were happening. And by the end of the week, she was able to take quite a few steps down the hallway of the clinic without her walker.
So I want to make sure I understand this. So she was confined to a wheelchair. If she was having a good day, maybe the walker.
Yeah.
But by the end of a week of treatment, she was able to stand up and walk down a hallway like a normal person would walk.
Yes.
That's remarkable.
Yeah.
That's 1 week of treatment.
Yes.
She was in the clinic every day doing this, and she had that result.
Yeah.
That is remarkable.
Yeah. And I've continued to work with her, and we've been getting her back into the Neuro 20 suit. We're hoping to be able to get Firefly therapy there back in Mississippi sometime in the near future. It's an unfortunate thing. There's no practitioners in our state right now that are using either one of these amazing tools.
Sounds like you got an opening for a new job.
Yeah. Well, I'm working on that. Yeah. But yeah. And, the progress that she saw here, she's maintained most of that.
That's amazing.
Yeah. Even without getting the dual therapy every day, she's still maintaining.
She's using Neuro 20 now at home.
Yeah.
Yeah. And I want to point out that when I talked in the opening segment about doing this, we bought the whole Neuro 20 kit. We bought the computer, we bought the 2 suits, the whole 9 yards, and Lori and I are using it. And it's not difficult. I mean, if I can do it, a chimpanzee can probably do it. Okay. That's about my level of expertise when it comes to anything to do with computers, but it's like an iPad. The thing is amazing. It's very simple to do. I did it on my own yesterday. Normally I had Lori set it up for me, but I actually did it myself yesterday and I didn't screw it up. So I was pretty impressed with that. Dr. Andersen, let's go back to something. So now we've seen 2 different cases here we've talked about. We have had had people with Parkinson's. We have had people that are dealing with MS. Let's talk about some of those specific results as we wind up on this segment a little bit.
Yes, it's really been exciting. Quite a variety of people, actually. I can't just say that all we're seeing is someone who's wheelchair bound or something of that nature. We've had people come to us who have had what the conventional system would say, you've got to have back surgery because you have some kind of spinal stenosis because of a disc. We had one lady come in that way. She was told she was going to have surgery. She had significant sciatic as well as foot drop because of a nerve pinch. And clinically, we would say, okay, that's a mechanical issue. You're going to have surgery in order to relieve that mechanical imposition on your spine. However, she didn't want to have to do that. She came in, she used the Neuro 20, and over several months, she got to the point where not only did she not have any peripheral neuropathy, she had no nerve or no foot drop, and she had no pain. She had no sciatic pain. And I just saw her a month ago, and we are about 8 months out. She still has no pain. She still has no foot drop. And it's amazing to me that you can do something that we think and the MRI showed was a mechanical problem. Now the symptoms are all gone from that just with the Neuro 20 suit. So we've had a number of foot drop patients. We've had a number of people that have chronic pain problems like the sciatic, like the radiculopathy down the arms because of neck issues. Or we actually have had an Alzheimer's patient as well. And when he first came into us, he was unable to remember names. His personality had changed. He was swearing at his wife. He was mean to her. Those things that we often see with Alzheimer's advanced patients.
Yes.
Very, very unfortunate. And so she was grasping at straws because there's really nothing other than putting him into an institution, which she was not about to do. Well, long story short, we're out several months. She admits he's no longer swearing at her. His personality has come back. He's joking with her. He can sit down and carry on a regular conversation with her. His memory is much improved. It's not back to normal, but his memory is much improved. He remembers the staff now, who they are, calls them by names. His ambulation has markedly improved. This is a man who's in his 80s. So we're not talking about a 23-year-old that was previously talked about. We're talking about an elderly man, and we know that it takes longer as you get older to heal. And so we've been able to address all of those things, again, with an integrative approach, though, because we're doing some nutrition, we're doing some dietary things, as well as the suit. And part of the suit that I want to talk about as well, and this is Dr. Cronin, who is he is a physical therapist doctor, has helped us improve the effect of the suit by integrating appropriate physical therapy with activity of the suit.
He did a show with us. He was quite
absolutely,
remarkable in the whole thing.
And that has become really a game changer for us with a lot of people, because it's not a matter of just putting a suit on and being there. It's that, okay, if we can identify your specific deficits, we then tailor the exercises to those specific deficits. So the suit helps with that.
It is remarkable. And I will tell you, that's exactly what Lauren, my wife, is doing now. Steve set up a program with Doctor for her. She's using that program now. In fact, she did it this morning before I left the house. They can integrate this thing. They can set it up so that it works specifically for you. If you know someone that's having issues like this, we've talked about a host of things here. Give them a call. Have a conversation. Learn what they can do. The phone number is 833-724-6522, 833-724-6522. The website's brandnewdaykc.com. We come back from the break. We'll wrap it up, and we'll learn about how they're ahead of the MAHA movement, the Make America Healthy movement. We're going to talk about that when we come back from the break. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. welcome back to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You know, this is a unique show. As I said earlier when we started, I think Dave and I have done these for I don't know how long, but it's been 19 years on the air, and I've never had three doctors in the studio at the same time. This is very unusual. I hope you're listening to this and taking advantage of the information that these three gentlemen are bringing forward to you in three very different fields that they work in, but how they're all coming together to talk about this process and how it can benefit people that have these kinds of issues, regardless of whether it's stroke or whether it's a Parkinson's issue or whether it's something along the line of transverse myelitis, whatever the case may be, it's worth exploring and seeing if they can make a difference to you. You heard Dr. Andersen a minute ago talk about a woman whose husband had advanced Alzheimer's and the differences that he has made in becoming somewhat more normal than he was before. The angry behavior, these are the kinds of things that happen with advanced Alzheimer's. So there are a myriad of things that can be done to help people with these technologies. I'm urging you to take a minute and pick up the phone and give them a call. If somebody in your family or a friend of yours is dealing with this, 833-724-6522, 833-744-6522. It's Brand New Day KC. That's the website, brandnewdaykc.com. They'll be happy to chat with you. So let's talk about the MAHA movement. You better tell folks what that is first, Dr. Andersen.
Make America Healthy Again. It was coined by RFK Jr., really. There was an executive order that Trump put out in February that the HHS Secretary, Robert F. Kennedy Jr., had to put out a report on the Make America Healthy status of the United States. That report came out last month. It was 73 pages. I read it through a couple times, made notes on through it. And
Are we healthy?
We are absolutely not healthy. We spend over...
Dr. Firouz would tell you the same thing. Dr. Carson would tell you the same thing.
Oh, yeah.
It's a mess. The United States spends twice or more per patient for healthcare, and we rank last of all of the developed countries in the world in our health, in our life expectancy, as well as our trend. We're continuing to get worse. We're moving further down the scale. So the next part of the executive order is that by August, RFK Jr. has to now come out with an action plan for addressing what's going on with the healthcare, with the health of Americans. And part of the MAHA report stated that industry capture is a big problem. Industry capture in medicine, industry capture in our agencies like the FDA, like the EPA, like the USDA, NIH, and so on and so forth. Okay, so the answer to that is then try to clean house, and you basically have to get a sledgehammer to do that, which is kind of in the works. There's a lot of gnashing of teeth and all that kind of stuff about that. But the problem is, and my wife and I, Lisa, were in Washington, D.C. last week. We both made presentations in the Russell Building of the Senate. I'm the vice chair of the Wellness and Nutrition Committee, and she's vice chair of the Chronic Disease Committee. And we made presentations. We talked to a number of our legislators, or actually their staffing people. And what's happening is that it's a very difficult process because it appears, in my opinion, it appears we're only replacing one industry capture for another industry capture, not really solving the problem. And I think Dr. Firouz said it excellently here just a minute ago.
Yeah, off the air. It was you two were going back and forth.
Right, we were having a conversation about that. And really, the answer to this is we don't need to research how to solve the MAHA problem, whether it's regenerative agriculture or whether it's regenerative medicine, as we've been talking about on this show a number of times. We have the answers, and it's a matter of implementing those. And it's through private industry, private consultants, independent consultants like Dr. Firouz, myself, Dr. Carson, Dr. Cronin, and so forth. And it's also about direct responsibility of the patient for taking it on. In other words, direct pay. That's what's happening. That's what you see happening where it is being applied successfully in industry around the world. We're not just talking about here either.
Dr. Firouz, talk a little bit because we've done, I think, 4 shows now on the guardianship program as we wrap it up here. Expound a little bit on what Dr. Andersen just talked about and why the 3 of you sitting here represent that model.
Right. First, I want to congratulate actually the Trump administration on bringing the MAHA movement to light, because it is the time to act for us. To us, as we all agree, the chronic conditions in 21st century, obesity, diabetes, cardiovascular, musculoskeletal, are the public enemy number 1. As far as I'm concerned, they're like the infectious diseases of the 20th century. We have the scientific tools and insights how to eliminate or prevent them. It's just a matter of the political decision for us to do that. There are discussions on how we can do that, but there's no question that there's a significant gap between a lifespan and the health span, which could be the topic of another conversation here, that the U.S. is showing the big gap between we may be living longer because we eliminate the infectious disease of the past century. Because of the burden of the chronic conditions, the 5 that I named, we are living actually those years with misery and in the doctor's office, and it keep increasing our healthcare cost. We just saw the parade of the Army. I'll tell you, we spend 5 times more than our defense budget on our healthcare, and we are the last one in the developed countries in terms of. So we have a very expensive, mispriced concept. And for every year that we can expand the lifespan healthy, that is worth over $300 trillion. $300 trillion. So this is not only the matter of quality of life of our nation, is the matter of the health of our economy. In the 21st century, the health is the new wealth. And that is what we can discuss later.
And we will discuss that. And again, as we wrap this up today, and I hope you've listened to this, getting 3 doctors in here with their level of expertise and bringing that information to you. The system that he just talked about, direct pay, using doctors that are outside of the system in terms of insurance and the rest of it. That's what we're talking about here. That's brand new day. Okay. These programs are not, you're not going to find these in a hospital system. You're typically not going to find them in a large group of physicians because it's not embraced by them. It's a different model, but it's a model that works, and that's why we've done these shows and testimonials to it. And I urge you, if you have anybody in your family, your friends, your church, whatever the case may be, your coworkers, they're dealing with any of these issues that you think they could help with, please pick up the phone, give them a call, 833-724-6522, 833-724-6522. It's brand new day, kc.com is website. Thank you all for doing this, from traveling here from different parts of the country and being here today to make this happen. And now I leave you with this thought from Dr. Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.